At the heart really of our strategy is integrated care. So how do we deliver better outcomes for patients at better value for the taxpayer? And to do that, we have to work in partnerships.
In working together with Wye Valley, we want to take the quadruple aim: improving clinician experience, improving patient experience, improving patient outcomes, and doing all of that in a way that reduces the total cost. We want to take that to the next level, and we believe that we can do that together.
Well, if you have good diagnostic facilities, you can hopefully not have to admit patients in the first place, get them diagnosed quickly and sorted out, and maybe avoid admission completely. Faster diagnosis means faster treatment, more accurate and quickly you can do it, then the better it is for everybody.
The partnership is an 11-year agreement which has been based on the rising demand for imaging services and an environment within the hospital that was no longer fit for purpose. So the real estate, the equipment, the ways of working, the flow was no longer sustaining what demands were being put on the service.
Philips is going through a journey. We're transitioning from a predominantly transactional-led organisation to a solutions and services-led organisation. And the way that we do that is that we focus on transformation on clinical services, operational services, financial services, but we also look at the experiential aspects of that with the ultimate aim of achieving on NHS's long-term plan and the quadruple aim.
The partnership is to do a number of things. Partly it's around replacing the radiology kit, but the other part is working with staff and engaging with staff to make sure that we use it as efficiently as possible.
With our redevelopment programme, our redesign programme, we've been able to completely change the physical structure of the department within the same footprint, increasing capacity in MRI, creating a new interventional service, redeveloping the general imaging portion, as well as the CT and ultrasound, providing a much more engaging environment for patients, an easier environment for staff to work, and the technology to support the service that they require.
It's not just about the equipment, it's also about transforming the pathways, transforming the way that patients flow through the department.
When we first started this contract in 2018, we commenced on a fast-track programme where we immediately replaced 13 assets. There were a number of mobile solutions, there were a number of X-ray rooms that we had to place. Then we moved on to the redevelopment. It was a 5-month project, a £2 million project, where we taped off the back end of the department and we knocked it all down.
At one point it was like working in a building site, and we managed to maintain all of our services really. It's been managed really efficiently. We've worked well as a team. The partnership between us and the operations manager has been really effective. I think the impact of all the changes that we've seen on patients and staff really, the whole environment is much more pleasant, it's bright, it's airy, the equipment's new, so staff have got that opportunity to work on really modern, up-to-date technology that's top of the range really in certain areas. From a patient point of view, it means we can do more patients, we're more efficient, and it's just a nicer experience for the patient.
Our image quality is great. We've got the SkyFlow setting on there as well, helps with our chest x-rays, and with the equipment being able to move more so than our old equipment, with our lateral hips and things, we're getting better exposures.
We're really benefiting from that advanced technology now through our partnership with Philips, and for example that is through compressed sense software on our MRI machine, which enables us to process and produce those images much more quickly. That is a minimum of 4 patients a day extra that we're now able to do, increasing our capacity and reducing our waiting times.
So this is fantastic for staff. Partly it's around our staff having access to state-of-the-art technology, which is professionally satisfying, but also it's about them being really involved in redesigning the department and redesigning the care pathways for patients. All that creates a really great sense of morale, and it makes it a great place to work.
I think it's a really exciting time really for both staff and patients, in the fact that we've got all this lovely new equipment. From a patient perspective, we should definitely see that services are more available and that they're getting up-to-date equipment, and we're offering them a good service.
The future is really bright for our staff, but most importantly, it's really bright for our patients. It's an innovative model, it's a different way of doing things, and I think both we and Philips have benefited from working together in partnership over these last couple of years.
We are so proud to be the strategic partner with Wye Valley. And we very much look forward to continuing to develop the service for the population of Herefordshire and to improve clinical outcomes for all.